Good afternoon, everyone. My name is Raki Nibar, and I'm a communications advisor here at the college. Thank you for joining us for this educational session, Building a Health Equity Program from the Ground Up, AMANI, Mental Health and Substance Use Services for Black Youth, presented by Kevin Haynes. Before I introduce Kevin, I'll go over a few housekeeping items. This session has live captions. To turn on the captions, click the Show Captions button below the video player. You can choose to see the live captions in either English or French. If you need tech support, please use the support chat at the bottom left-hand corner of your screen. Click on the icon and you'll be connected with our live support team. There will be an opportunity to ask questions at the end of the session. You can submit your questions through the chat feature on the right-hand side of this session's page. It is now my pleasure to introduce to you Kevin Haynes. Kevin is the Senior Manager, Black Health Strategy for the Provincial System Support Program at the Center for Addiction and Mental Health. He is also an adjunct and sessional lecturer in the Factor in Wintash Faculty of Social Work at the University of Toronto. He is responsible for leading the provincial expansion of AMANI, Mental Health and Substance Use Services for Black Youth at CAMH, the first ever Canadian hospital and community partnership of its kind, and focused on advancing care for Black youth. Please join me in welcoming Kevin.
Can adjust this a bit for my height. Good afternoon, everyone. Thank you so much for joining. For folks in the room and for folks online, thank you so much for joining for this important topic. My name is Kevin Haynes. Again, I'm a registered social worker, so I think first and foremost, that's always important to ground folks in where I'm coming from. And I'm really excited to talk about our program here, AMANI, Mental Health and Substance Use Services for Black Youth. This program has been around in the community for a very long time, and it's been through quite a journey to get us to where we are today. So I'm really excited to take a deeper dive and share a little bit more about our journey with you. Good start. It's working. So, as I was mentioned, my name is Kevin Haynes. I'll skip over my bio pieces because that was already done. But again, I work at the Center for Addiction and Mental Health, or CAMH for short, and I work in our provincial system support program. I'm a senior manager of our Black Health Strategy portfolio. And one of our key projects is the spread and scale of AMANI, Mental Health and Substance Use Services for Black Youth, which is what I'm going to be speaking about today. But I always find before we actually get into the weeds of how the program works, I think it's important to set some context as it relates to why we have this program and some of the work we're looking to do to address disparities across the province. So when we look at Black health in Canada more broadly, so even more broadly than Ontario, we see a lot of disparities in health outcomes as it relates to Black populations when it comes to health outcomes. So if we think of chronic disease, higher prevalence rates of diabetes, hypertension, chronic rates of stress that are contributing to some of these factors, this impacts our health. And oftentimes, this is not a conversation that we necessarily have at the point of care, but it's important to understand that young people, people of all ages that we're working with, this is our experience and it impacts our health. And if we're not addressing these broader social determinants, sometimes we're just putting a Band-Aid solution. So I always like to start with that. When we think about Black communities in particular, lots of prolonged exposure to trauma, oppression, colonialism, racism, segregation, some of these experiences have led to some of the conditions that we find communities in today trying to navigate. Black youth in particular, which is the focus of our program that I'm going to get into, face a lot of mental health disparities. So when we look across the system at access, at quality of care, when we look at wait times, when we look at rates of engagement or disengagement from care, we see a lot of disproportionate outcomes as it relates to Black youth in particular. And we know as social workers and social service workers, the importance of early intervention, right? The sooner we're able to intervene and to make a difference in folks' lives, generally the better the outcomes are. So the further upstream we can move to address some of these disparities, when we look at Black communities at large, we have a tremendous opportunity to make an impact on population health outcomes overall. So social determinants of health, should be our bread and butter as social workers and social service workers in health spaces. When we think of what makes Canadians sick, so there's often many different frameworks. I think one that we often use from York University really took a deep dive into understanding what are some of these social determinants as it relates to Black communities, or to communities at large, rather. So we think of income, we think of education, housing, so many different pieces that are inherent to our life. That's outside of our actual physical or mental illness that's contributing to some of the symptoms that we're experiencing. But I think even more broadly, when we think of our healthcare and how that impacts our health. So access to care, healthcare systems, wait times. If we think of our biology and sometimes where that might play in terms of genetic predispositions, broader things that might be hereditary and passed on from parents, and our environment. We know, healthcare systems are political, and often the political climate can also impact how we are doing and what our outcomes are. So just to kind of situate. So if we're taking a deeper dive and we're really exploring the impacts of systemic racism. So sometimes when we're talking about racism, folks feel that we're talking on an individual level, but it's sometimes important to take a step back and look at the system. So systemic racism, when we look at that, is embedded in major systems and structures throughout our society. Just to name a few, the criminal justice system, education, employment, healthcare. Anti-Black racism, when we're looking at systemic racism, is specific racism that's targeted to Black communities. There's a term coined by Dr. Akua Benjamin, really speaking about the unique experience that Black communities face, which also includes lateral racism from other racialized communities as well. So really to understand the unique positioning and why a tailored intervention is really, really important. Black children in Canada often face discrimination in multiple sectors. So disproportionate involvement in child protection, higher rates of exclusionary discipline in schools. We see less pathways that lead to post-secondary education. We see a school-to-prison pipeline in many spaces. And often there's so many different sectors and systems that are kind of interlaying. And I also often found myself trying to think of, how do I just capture all this information succinctly? And one day it just kind of came to me, and I was really thinking about these broader systemic issues. And I was noting Black communities are overrepresented in spaces where you wouldn't want to be, and underrepresented in spaces where you would want to be. And I've tested that in my head with many different systems, and I've yet to find an exception. So if anyone does have one, please feel free to let me know, and I'll note that down. But if we look at education, employment, spaces where you would want to see yourself represented, we're seeing underrepresentation there. If you're looking at, the criminal justice system, child protection, spaces where you wouldn't necessarily want to see a high prevalence, we're seeing a lot of overrepresentation there. So just to really help contextualize some of these systemic pieces that are at play that need targeted interventions to address. So when we look at Black youth in particular, so there's a lot of intersections between Black youth and interactions with police. We've seen many instances of higher rates of carding, so stopping folks and asking them what's going on without necessarily having a broad merit to do so in the moment, and living in communities that are at higher police surveillance rates than other communities. So just to give an example, in 2021, the Toronto Police Service released some data noting that Black youth were 1.4 times overrepresented in arrests in comparison to their prevalence in enforcement action. So really understanding where discretion can come into situations as we're working with clients and families, and where we choose to bring in discretion and where we don't. These are some of the pieces that we're looking at when we're looking at some of the systemic barriers. So I always like to ground us in some stats. So around the pandemic time, for folks, it seems like it was just yesterday, but there was a survey that was done by the Mental Health Commission of Canada, really looking at mental health care usage for Black Canadian communities. So it was surveying folks and looking at data over a long period of time, noting that 38% of Black Canadian residents with poor or fair self-reported mental health access services between those years, 2021 and 2014. So If you look at the dots, just representative of individuals, those shaded dots would be folks with poor or fair self-reported mental health who actually access services. And the rest of the dots, folks with similar or poor or fair self-reported mental health who do not access services. So just from looking at this, we can see that there's a need to increase access. I mean, there's lots of conversation and question that can come in terms of what are the barriers to accessing care, and those are some of the pieces of work that our team and our community partners have been doing, and I'll get into those in a second. But I think just to set a baseline, access is a barrier, and we need to unpack that. But the survey actually went further, and it noted 60% of folks surveyed said they would be more willing to use mental health services if their mental health professional were Black. And I ground this presentation in this fact because I think it's such an important piece when we're talking about representation and care and representation in spaces in general, right? Being able to see yourself reflected in a positive light, not necessarily in ways you might see yourself reflected on the news or reflected in statistics. If we look at education sectors, we often see underrepresentation of, educators from Black communities and other racialized communities as well. But representation makes a huge difference. It's not the end all and be all. There's many different pieces in terms of capacities and training and things that need to be built around that. But it's important to remember that representation in itself is an intervention. And how we can think about diversifying the healthcare workspace, that in itself is intervention. And overwhelmingly, 95% of folks surveyed noted that the underutilization of mental health services by Black Canadian residents was an issue that needed to be addressed. So if we look at the community at large, we know that we're not accessing services at the rates that we should be. Many folks noting that increasing representation would support with addressing that barrier. And overwhelmingly so, this is an issue that needs to be addressed. So the need is there, and I think it's important to ground that because I think sometimes when we're talking about Black communities and mental health, and I'll get into some of the stigmas and pieces there, sometimes there's an assumption, maybe folks aren't ready to access services or they don't want to. I think when I look at this slide, this really speaks to an appetite to access services if the conditions feel safe. And I think that's what we're really talking about. How do we build cultural safety into spaces so that folks feel comfortable accessing the services that are available to them? So I talked about really unpacking some of these pieces. So one of our community partners called the Black Health Alliance. I'll talk a little bit more about the Black Health Alliance a little later. But they were really one of the champions of leading this project called Pathways to Care. And essentially, Pathways to Care was a research project that was conducted over 5 years throughout the province. I believe it was 2017 to 2022. And it really looking through, mixed methods, how to really unpack what some of these disparities that Black youth in particular were facing as it related to access to the mental health care system. So a lot of interviews with young people, with families, with service providers, looking at broader data across the system in terms of disparities in access, really to underpin what's actually going on and what are some suggestions for interventions that might help to target that. So again, through that report, some of the key findings that we're seeing: systemic racism. Again, we talked about that earlier. Poor system coordination. This is a really important piece. Oftentimes, there's a lot of systems and service providers across the province, but we're not necessarily connecting those systems, and it makes it very difficult for young people and their families to navigate. So that in itself is a barrier. When you layer on systemic racism and experiences of oppression, it can make it even more difficult to navigate a complex system. Representation, we talked about that in some of the last stats. Representation being a barrier, a lot of youth not feeling comfortable accessing services because of lack of representation in different spaces, not seeing themselves reflected, not feeling welcome in spaces. But the report didn't just look at what some of those barriers were. Again, we want to look for interventions, right? So part of the work was also, what are some solutions? How can we generate some of that knowledge with the community so that we can build on some of those pieces moving forward? So some of the key recommendations that came from this report: developing Black-specific programs was one solution. And again, that's not to say that every service has to be Black specific, but increasing that representation in the system builds systems capacity. That's another service provider to partner with, to collaborate with, to think jointly about how we can build some of those solutions. And we know for some young people, that might be a point of access where they might not access services anywhere else but that place. So if nothing else, that could be the front door to broader access to services as well. Creating culturally competent service pathways. So again, when we're thinking about the coordination across the system, how do we actually coordinate amongst ourselves as service providers, as systems, so that we make it easier for youth, young people, families to navigate the system seamlessly? So that means, service navigation, data, not having to repeat your story multiple times in different spaces, especially when that story is inherently sensitive to you, especially when you're talking about experiences of racism and oppression. So not having to repeat that at every stop along the way, for that to be incorporated as part of your care. And last but not least, all this can't be done without funding, right? So increasing funding for Black-led and Black-serving organizations as well. Oftentimes, a lot of this work in terms of building these systems, partnerships, and collaborations, this is oftentimes work that we do as social workers and social service workers, like kind of off the side of our desk, not necessarily having protected time. So I was thinking about even administrative costs, what it means to build meaningful partnerships and sustain them, what data we need to support that, and how do we actually fund the broader scope of services that increase access. And direct service provision is important, but when we think about our practice, what about that macro and meso level of practice? How do we actually intervene in some of those spaces as well, but it's not specifically direct service? So that's a holistic approach. So I want to get into a case study because I didn't want to just come here and tell you things that maybe you already know, maybe it's new for some folks. I think it's really important to ground, but I want to walk you through a journey of a young person who took a courageous step to share their story with the support of their mother. So this is a young person under the age of 18, so they won't be identified as we know through various legislation, but they work with their mother to publish a story about some of their experiences. So you can see here the title of the article, and I wanted to start with the title. I'll have the citation throughout, but I think it's really important for folks who want to actually take a deeper dive and learn a little bit more about the story I'm going to share. Family Reflections. My son's perspective on his experiences, incarcerated as a youth with a chronic disease. This was published very recently, just within the last year, a young person, and speaking about some of their mental health experiences throughout the system. So to get us started, the first line here that kind of came from the paper, and I'll read it out for the benefit of folks. As a parent of a youth who has been incarcerated in multiple facilities across the Greater Toronto Area, I can attest to the extreme stress, trauma, and devastation it brings to the family structure and unit as a whole. So really just kind of setting the stage. We're looking at a young person who's been in and out of the justice system, haven't yet heard about some of the details as it relates to their mental health concerns, but we can hear in how the mother wrote in this paper the devastation and trauma it brings to the family as a system, right? So oftentimes we look at the individual when we're working with young people, and there's a lot of work to be done with the individual, don't get me wrong, but how do we also support families and caregivers, a whole family, client and family-centered approach to care? Because we know when we work with young people, they go back to their communities, they go back to their caregivers and their families. So if we're not supporting the whole system, again, we're putting another Band-Aid on as a solution that we know over a long term isn't going to be effective. So this paper was very interestingly organized. The mother kind of started off to set the stage, and it was a de-identified account of the young person's experiences in the facility. So the rest of the quotes that we're going to see are directly from the young person sharing about some of their experiences here in some of these facilities. So I'm going to read. Throughout my time incarcerated, I've dealt with many mental health and addictions challenges. It was a major struggle for me. The facilities I was in did not have the resources to attend to my challenges. Again, I think this is a really important narrative that we're hearing from a young person. So many things going on. We're seeing an intersection between mental health and the justice system, We're seeing a young person in the justice system who feels that they're not having access to mental health supports that they need to just live, right? To live a meaningful life. And again, when we're looking at the justice system in particular, accountability and all those pieces are important. So it's not to discount those pieces, but healthcare and mental health care is a right for everybody, right? So no matter where you are, no matter where you're setting, everybody deserves healthcare. So this is a young person who feels that they're not getting that. So this is a young person, and again, the paper speaks to some of the more details. This is a young person who had a severe opiate addiction and who was on opiate agonist therapy, so needing like something like Suboxone or something like that to support with their mental health care. They spoke in this paper about asking for support kind of when they got to the justice facility, and the response they got from the workers said, "Our doctor only comes once a month." So imagine that you have a very acute addiction that oftentimes folks are going daily to their service providers in the community, and to hear a response that our doctor only comes once a month. Just let that sink in for a bit. These are some of the pieces that we're talking about when we're looking at systemic barriers to care and how that impacts the trajectory for young people throughout the system. So I'm going to go on. So this young person now shares about some of their experiences and what that felt like. Instantly, I panicked and started feeling even more unwell due to the anxiety of knowing I would not get the support I needed. I headed to my cell and suffered because of the intensity of the withdrawals. So again, this is a young person experienced significant withdrawals, feeling like the system is not going to help me. I've tried, I've asked, I've talked to many folks, and nothing's happened. So I'm just going to go back to my cell and suffer. Again, lots of work to do as a system, lots of opportunity, but lots of work to do. There's lots of barriers to care here. And we think of youth in custody as a particular example. Oftentimes we don't bring those youth into the conversations when we're talking about mental health care. We're talking about, setting up our nice clinics with our nice chair and pillow and all the nice setup, but we're not actually looking at lots of folks who need services we're not reaching. And how do we actually work differently to ensure that everybody has access, no matter what their setting is, and we're coordinating systems so that a young person who has these needs, either A, is not in a space where they don't have access to that, or we're coordinating to bring those services to them, because we know that continuity of care is very important. So when we look at healthcare in custody, that kind of begs the question, who's actually getting care and who doesn't? So this young person talks about some of their experiences in care, or in custody rather, and really some of the acuity that presented from being in custody. So feelings of suicidal ideation and, life isn't worth living. So this is a young person really who's needing support, even outside of the key issue that brought them in, just from their experience being in the system. And this is what they reflected in that paper. The only reason I met with the doctor and the social worker frequently was because of my active suicide watch. Without me being suicidal, none of my other mental health and addictions challenges at the time would have been attended to. I was a liability to them, so that's when and only when I got the care. So again, imagine yourself as a young person, and this is your perception, this is your worldview, based on experience, not even just based on broader pieces, right? You've asked, you've pled, you've done what you could, you've tried to advocate, and not having access to the point where you're now actively feeling suicidal. And that's the first time that you feel that you're able to access some of the resources that you've been asking for a long time. Again, we talked about early intervention earlier. That doesn't look too early, in my humble opinion, right? So how can we actually recreate systems and deliver care in different ways so that we're actually attending to folks in spaces when they need it, where they need it, at the right time by the right provider? So the interesting thing about this paper is the youth actually brings a dual perspective. They talked about some of their experience, but they also talked about, again, this really highlighting this resilience, this opportunities for change. So it's not just this is all the things that's happened, but What can we do as a system to make things different? So my honest suggestion for change is to equip youth facilities with pediatricians as they specialize in youth care specifically. One of the reasons they don't have pediatricians in youth facilities is that not all the people incarcerated are youth. Some are young adults, which doesn't fit the criteria for a pediatrician. Even so, these facilities must include all appropriate levels of health care to meet the daily challenges of incarcerated youth. So again, we're seeing an intersection here with the Youth Criminal Justice Act, so young people under the age of 18, and how that's treated differently throughout the system. So this is a young person who's talking about their experience. They would have, for whatever other reasons, qualified for a pediatrician based on their age. But based on the facility they were in, didn't have that type of specialist physician. So they probably had like a general provider who maybe didn't quite understand some of the nuances of what a young person under 18 might need from a healthcare provider, from a doctor or physician more specifically, and talking about what difference that would have made. The paper talks a lot about, sometimes meeting with the doctor, you get 5 minutes, right? You come in, you leave your cell, here's 5 minutes, tell me what your issue is, and going back. And really feeling like it makes you feel unwanted, unheard, unseen. And then, why would you want to open up in a space like that? So some of these tangible things that we can actually make meaningful change. Again, the government and medical practitioners working in the facilities are responsible for seeing what is happening to us and advocating and speaking up for their clients. Again, this is a young person speaking there. And I think this is really important, especially for us as a profession, social workers and social service workers. Advocacy is one of the key pieces of this profession, right? So this is a young person calling out to say, this is happening. We need to bring some visibility that this is happening. And as a system, what are we going to do about it? Because this is not acceptable. We shouldn't just leave this as status quo. Something needs to happen. And unfortunately so, oftentimes it's young people who have to be the ones to speak out and ask for some of these changes. So what can we do as service providers to support and advocate in ways that we know through our profession? How can we be that voice to bring some of that systems change? And I'll leave you with this last piece here. It's essential that when a youth is released, the pediatricians should provide medication, provide a list of places that have pediatricians, and provide them with mental health centers or phone numbers that the youth can call if ever in a crisis. So again, they talk about the experience leaving justice facilities and sometimes not getting the resources or getting handed a little pamphlet and saying good luck. And they talked about in the paper their experience or their perception, even speaking with other youth in the facilities, that's often a reason for high rates of recidivism. So this kind of revolving door between the justice system and the community, because folks aren't actually connected with the services that they need at that point or even afterwards. And again, we talked earlier about the need for improved system coordination. So this is, again, really highlighting and reflecting that. And then finally, this young person leaves us with a call to action. The healthcare system for youth held in custody needs to fill many gaps. Gaps are an understatement, more like potholes. However, with that said, I pride myself on being optimistic, and I believe that holes can be repaired and filled with the right amount of dedication, care, passion, and accountability. And again, I think that's really important. Some of those pieces noted there at the bottom. Dedication, care, passion, accountability. How can we bring those elements to systems? How do we bring that to us, with us as providers? Because accountability is really what would help us to move systems forward, right? And dedication as well, too. But accountability is what ensures that those pieces are moved forward with. So I hope that's helpful. I wanted to let us reflect and let that sink in, because oftentimes these are experiences of young people. Even if you might say, well, I don't work in the justice system specifically. And that might be true. But these might be experiences of a young person. And this might have all happened before they even come to you. And not unpacking some of these pieces, not understanding the impact of some of these pieces is going to impact the care that you're providing, because the youth, again, is not going to feel seen or heard or understood. So it's really about understanding when we look at the overrepresentation, there's an overrepresentation of young Black youth who have experiences like that. It's not to say everybody has that experience, but when we're working with people, and this is just one sector, then we look at child protection, then we look at education, then we look at suspensions and expulsions and all the different systems across, and we can say, okay, these might be the outliers, but there's an overrepresentation of outliers, and that needs to be addressed as well. So a quote that I like to often help frame when we're thinking about what systemic racism is, or racism more broadly. Racism is not merely a simplistic hatred. It's more often broad sympathy towards some and broader skepticism towards others. And I really like this quote because I really feel like it lands with some of the pieces that we're talking about. So when we think of a young person who's coming and asking for help in a vulnerable space, and where is that feeling of empathy and sympathy for the situation to say, you know what, let me do something about this, right? And when do we choose to exhibit that and when do we not? That discretion is what we're really looking at when we're talking about what systemic racism looks like in practice. Because I think sometimes we talk about it at this high level. That's embedded in systems, right? So imagine, using that example, imagine a young person going to all the staff across the facility saying, I'm really having severe withdrawals, I need support. And the response is kind of, oh, well, go back to your cell. That's what we're talking about, how it looks like. That's the head of systemic racism. And it's something that can be fixed. So I wanted to share that there. So again, one of our community partners, this is again work led by the Black Health Alliance. So one of the researchers there, Melissa Booker, who we work very, very closely with through the Black Health Alliance and team, they did a social network analysis, really to understand what's the current system looking like as it relates to Black service providers and mainstream organizations. They define mainstream organizations as anything other than Black-led, Black-serving, and Black-focused organizations. So take a minute to look at the visual here on the screen. I find this visual really speaks for itself. And there's a full article for folks who want to take a deeper dive. But I can very clearly and visibly see that we're not building a lot of meaningful connections with Black-led and Black-serving and Black-focused organizations with the broader system. Again, many questions why, and things that need to continue being unpacked. We heard about some of them through the Pathways to Care project that I talked about, but I think it's really important when we're talking about systems, not everybody is connected. And I use the word system very loosely because if I look at some of the Black nodes on the screen, they don't look to be incorporated into the system. They look to be on the peripheral. So how do we actually understand and appreciate that many of these organizations are serving Black youth, Black communities, providing great services, but they're actually not being connected in with some of our mainstream organizations? And what does that mean for the services that are provided, not only in those organizations, but across the system? Look at the loss of expertise in the system by not connecting in and hearing directly from communities about some of their experiences. So I think this is a really important piece here because this is exactly what we are trying to address with our work with AMANI. So I'll get into that. Hopefully you're following my logic here. That was a good segue to what we're actually trying to do with AMANI. And I think it's really helpful to understand all those pieces so that the scope of the intervention makes sense. So what is it? I couldn't just start at AMANI because there's so much history to go through. I put it all in one slide, 30 years in a slide, over 30 years now. So excuse the brevity, but if you'd like to hear a little bit more, please send me an email. Hopefully folks have my email, connect somehow, LinkedIn, and I'll be happy to share. So this is a program that actually is established in the early 1990s. The original name of the program was called the Substance Abuse Program for African, Canadian, and Caribbean Youth, or SAPACY for short, because it was a bit of a mouthful. So we use SAPACY to help it be a little bit more socialized. The program was doing great work. It was actually started in community and was rooted in the community. So for folks who are familiar with the Toronto area, the Little Jamaica neighborhood, Eglinton West, that's where the program really started and kind of took its grounding. And lots of tremendous opportunity, and what a tremendous asset for the community at that time. Over time, we're seeing, I should say we, because I was probably, who knows, on a playground somewhere around that time. But the community was seeing a lot of need. So when we look at this revolving door that I talked about, so youth or young people going into the system, being connected back with the mental health care providers, and the kind of this revolving door back through the justice system. So the community kind of mobilized and said, we need to build around this model to improve the infrastructure. So the program actually moved to, at the time, what was the Donwood Institute, but into the Center for Addiction and Mental Health when the organizations amalgamated in the late 1990s. And the intention of that move was to support with more clinical and administrative support. So thinking if the program has a better connection with the hospital, and especially one of the leading mental health, or the leading mental health hospital in the country as CAMH, there could be a strengthening of the clinical capacity to support the young people, because we're seeing such tremendous need. You can see in 2022 that this program was funded to expand to 7 community satellite sites. I mean, there's a lot between 1998 and 2022. So I think there's a few missing opportunities for data points there. But really speaking to what it takes to bring systems change through advocacy over time, through partnership with community mobilizing, and really understanding there's a need here, and we're going to be relentless with advocating for this need because it's so important, and this is literally the difference between some folks' life and death. So in 2022, this program expanded. I joined the program as a clinician in around 2018. So did a little bit of work in that role before I moved into this more administrative role in 2022 when the program was expanding across the province. I'll get into that a little bit more in some of our next slides. Fast forward a few years to this year, we recently received an investment from Health Canada into the program to really build out the model, and not just build out the model in terms of our service providers, but they're actually funding us now to build a consultation model. So this idea that we could build a consultation team that could support broader teams across the system, and building capacity about how to support Black youth and Black young people in spaces that maybe don't have as much representation or need to increase and build capacity. But also in part, how do we better coordinate and collaborate with broader systems so that youth are getting to the right care at the right time? Again, we don't want to create like a silo where it's only young people being seen through what's now AMANI. We want to connect them with the broader system, but how do we do that safely and effectively? And also, how do we build the broader system's capacity so that it's not just on, Black-led and Black-serving organizations to take care of the need of our young people? So that brings us to March. We were very happy in Black Mental Health Week, where we officially launched the rebranding and moving towards our new name, AMANI, Mental Health and Substance Use Services for Black Youth. I'm going to get into what that means in our next slide here, but I want to first, before I get there, really speak about how this program has been rooted in community since the beginning. These are only but some of the folks who are supporting the advocacy journey, the visioning of the program, helping us move forward over the many years and decades that this program has existed. But it's important to note that because it's not a program that's just existing in isolation. It's really grounded and rooted in community strength. And without that community strength, not only would we not be here, but we wouldn't be here in the capacity that we are. So it's building on the knowledge and partnering meaningfully with communities to address concerns, because we know the knowledge exists in communities. So how do we partner to build those interventions? So about AMANI, what does it mean? So it's the Swahili word for peace, and it's the Arabic word for wishes. And I'll tell you a little bit about the journey, about how we got there. So we have youth advisory, which I'll talk about in more depth in a further slide. But they really help to co-create literally everything you're seeing in terms of our branding, the colors, the feel. This was done in collaboration with young people. We have an advisory panel of many young people across the province. And it was a journey of about, I think, over a year and a half that we were working with them to really co-create and understand where we were moving. And for many reasons. So I think one, I mentioned the previous name, kind of a mouthful to kind of share, but it also grew to be a misnomer in the sense that in the name, it was really focused on substance abuse. And we were a broader program that was supporting mental health and substance use concerns. So, and I use that terminology very intentionally. So not to say what we sometimes call concurrent disorders where they're happening at the same time. It could be an either or a both and. So that's where we've very intentionally said mental health and substance use. Even a small decision like that is intentional because we know, especially for young people who've been over-policed and over-criminalized, it's not easy to come and say, I'm using these substances to get care. So we often noted that many youth who were using substances were not saying because they didn't want to get in trouble. And it's only after you've built trust that you could learn that, oh, well, there's actually a lot going on. So really creating a low barrier space where we could really dig into some of those pieces there. So who we are, we're a collective impact initiative. That's the way that it's a framework that we're using to help define this model. And I'll get into what collective impact is in a little bit. But essentially, we're trying to harness the strength of community to work together. So again, when we looked at that social network analysis and looking at all the different organizations that were not necessarily intentionally connected, we're looking to reverse that through this intervention. So it's the first ever Canadian hospital and community partnership of its kind, really looking to advance care for Black youth. So here are all of our current community partners. I'll get into some of the rules in a little bit. But we have, again, the Centre for Addiction and Mental Health, the Black Health Alliance, CAFCAN, Caribbean African Canadian Social Services, Hamilton Urban Core Community Health Centre, Rexdale Community Health Centre, Taibu Community Health Centre, Roots Community Services, Upstream Ottawa Mental Health Community Support, and Windsor Essex Community Health Centre. I'll put them on a map for you so you can kind of see where we're at. And we're actually very happy to be looking to expand this year. So we're going to actually be adding 2 more sites across the province within this fiscal year, which we're really excited about. So when I talk about collective impact, what does that actually mean? There's essentially 5 things, 5 key ingredients that make up collective impact initiatives. So the first piece, having a common agenda. Having community together to mobilize and work towards an issue to solve. So as we're relating to our program, some of the systemic barriers that we're seeing as it relates to mental health access for Black youth and the anti-Black racism that we're experiencing in the system. Shared measurement. Again, we have to measure to make sure that we're making improvement and to remain accountable. So working towards how do we measure consistently across our program to really make sure we're making the intended impact. What I call mutually reinforcing activities. And I think the visual is actually a great example of that. So when we look at a bunch of folks trying to push the boulder up a hill, that's a mutually reinforcing activity, right? Imagine if it was one person trying to make that movement by themselves. It might be overbearing or overburdening. So how do collectively we support each other and moving the work forward? Because we know it's a heavy lift to do what we're looking to do. Continuous communication. So how do we communicate across the province, across our sites effectively so that we can keep each other up to date about what we're doing, how we're doing it, and how we can make some of those changes. And last but not least, what we call backbone support. So there's an organization that's my team, kind of like a project management team that really supports with all things in terms of implementation, evaluation, knowledge mobilization. And the intention is, let's take the burden off of the site so they can focus on providing the care, and our team can support the broader sites in doing some of these data pieces. And again, it can't be an all or nothing. So there is needing to be capacity building at individual sites, but this is how we can kind of support that across the province. So where we are, again, we're really currently focused in Southern Ontario as where we started and kind of building out from there. So again, we talked about starting in Toronto and the North York area and what was CAMH and moving broader. But you can kind of see where we're dispersed. We're definitely appreciating that there's a lot of need throughout the north as well. So we're very actively looking to build our infrastructure to figure out what our path forward. Actually, a couple of weeks ago, I was in Sudbury, Ontario, and meeting with community. There was a Black youth mental health event, and we were learning more about some of the needs of Black youth in Sudbury and meeting community partners and learning about opportunities to partner. So we hope as we continue to grow through our provincial expansion, that we'll continue to chart our path north, as we know there's a lot of need as well. Work in progress as we're relating to our mission. And again, this is all co-creation that we're doing with our partners. So things are iterative over time. But we're really looking to improve the mental wellness of Black children, youth, and their support systems, including families and caregivers, by developing and delivering what we call culturally affirming and effective hospital and community-based interventions through an Afrocentric lens. So just to kind of give a sense, and I know the question that we often get, like, what does Afrocentrism mean? So I'll give the working definition in a bit of how we're defining that, but really with the vision of having equitable health outcomes for Black children, youth, and families. So really trying to address some of those disparities. Again, what's kind of guiding this work? So we talked about culturally responsive and affirming services. So it's really understanding that culture is important to everybody. Culture is inherent to our being, how we see the world, how the world might see us, and how do we bring that into the care space, so that person-centered and client-centered approach. We know the importance of equity and diversity, inclusion, and accessibility throughout all around, so constantly striving to be as inclusive as possible as it relates to those pieces. Anti-oppressive and anti-racist practices. Again, hopefully this is inherent to us as social workers and social service workers, the idea of anti-oppressive practices, and really trying to break down some of those barriers. Working from a trauma-informed lens, so understanding that many young people have experienced trauma, and how do we bring that recognition into how we design and deliver care and how we deliver systems. But it goes a step further when we talk about healing-centered engagement. So the idea of healing-centered engagement, really building on this idea that healing from trauma happens in community, rooted in community, because it's not just a singular individual experience, especially when we're looking at things like racial trauma. So the impact of racism on our bodies, both physically and mentally. Some of that healing comes through community. So how do we engage community more broadly to heal? Cross-cultural skills and awareness and competencies. We know Black communities aren't a monolith. So there's a lot of nuances that need to be explored and understood to really do this work and to interact with broader communities as well. We know that many folks wear many hats, so respect for intersectional identities and lived experiences. There's not one singular story or experience, so we really have to center that through our work. And last but not least, I mentioned embodying Afrocentric values and approaches. So again, I'll give you our working definition that we have on our website when we're thinking about what Afrocentrism means to us. So Afrocentrism is the import, respect, and dignity afforded to persons of African descent, the multitudes of African cultural expression, values, and, in light of the pervasiveness of racism and systemic oppression, the right of people of African descent to strive for self-determination. It recognizes that common ancestry serves as the critical linchpin for African, Caribbean, and Black peoples, whether they are multi-generational Canadian, have immigrated to Canada by way of Africa, the Caribbean, South or Central America, England, the United States, or elsewhere. At its core, Afrocentricity seeks to combat a complex history of anti-Black racism and colonialism, and to honor, celebrate, and respect African, Caribbean, and Black people. So this is really what's really underpinning our work. It's not just looking at it from a deficit-based perspective, but how do we celebrate these cultural nuances and cultural differences and the cultural pride that we bring, and how do we really highlight that and instill that as a value, that's something to be proud of for the many cultures and communities that make up Black communities. So how do we make it all work? This is kind of how we try to organize ourselves. So there's a model that we've adopted. It's called the Constellation Model of Collaborative Social Change. And essentially, this is a model about how we can organize communities and partners in a decentralized way. So oftentimes when we're working with so many partners, especially when some partners are much larger and bigger organizations, power sometimes isn't distributed equally, or it's hard for it to be distributed equally. So using this model, which we have adapted and I'll share in a next slide, is how we can think about how do we decentralize from this top-down hierarchical structure to move towards a more horizontal governance structure where we're able to share power across the partner and across our services. So what does that actually look like for our program? This is how we've organized ourselves in terms of our governance. So we have a leadership table. So the leadership table it has the leaders from each of our sites who really sit there, and that's one of our key governance structures. And in collaboration with our backbone team, which is, again, my project management team, we really support with the project management, the implementation, the evaluation, again, of their community partner, the Black Health Alliance. And then we've convened what's called in the model like constellations, which are like working groups or action teams. So you can see some of them here. In the interest of time, I won't get into all the details, but I'll share one of the first ones that we actually convened was our Provincial Black Youth Advisory Panel in 2022. So when we were looking to convene that, we were looking for, I think it was about 15 young people across the province to really help us co-create and co-design the model. So we put up an ad for about 2 or 3 weeks. And within that time, we got 150 applicants, which we were very excited about. But then we said, well, what are we going to do with all these people? We have to figure out. We didn't have the heart to say, you know what, you're not going to be part of our advisory. So what we decided to do was create a broader online network of young people. So we kept them engaged in various different capacities. We're able to pull on them and build with them and their expertise and youth advisory work that suits their interests over time. So we have one that's our frontline service providers. We have our clinicians in a community of practice. We have a table focusing on data. We have a table focusing on implementation. So how do we actually move the work forward? And as of recently, we have a table that's we've convened. It's really focusing on our French language services. So we're really trying to get into the space of providing services in languages that are familiar and comfortable for folks as well. So throughout some of our programs, we're looking to actually hire bilingual staff to deliver care in both official languages. Again, high level, I won't get into the details, but we organize ourselves in this framework to really understand what each space does so we don't duplicate services. So we think of the leadership table, again, one of the key pieces I noted, representation from each of our community partner sites. And this is really the key space that's really helping us to drive the strategy in collaboration with our backbone team and really accountable for some of the progress that we're looking to drive. The constellations, so I noted many of those constellations there, and those are really the folks who are engaged in doing the work and moving it forward. So not so much the backbone team and the leadership table. It's how do we actually partner with community, the young people, the frontline staff, the supervisors to build out the model over time. And again, our backbone team. So it's my team at ChemH partnered with our community partner, the Black Health Alliance. And I noted many of the pieces that we're looking to do, the implementation, the evaluation, knowledge mobilization. How do we build a sustainable model? 6 core things that we look to do with this backbone team to help us move this work forward. So again, I talked about guiding the vision and the strategy, supporting alignment across the initiative to make sure that we're all on the same page, supporting us in establishing shared measures so that we understand what's going on at different spaces of the province, what we call building public will, getting folks excited about the work, doing things like this, presentations in the community, outreach, so that folks understand what we're trying to accomplish and want to support us and join the movement as well. I talk about advancing policy. We know that policy work is important and this work can't happen in a silo, right? There's many policy pieces that need to shift to enable this work. And I use big P policy if we're looking at like provincial and national policy, but also organizational policy. And last but not least, how do we mobilize funding to move that work forward as well? I won't get into the indicators, but I want to put this slide here. There's some evidence-based indicators of things that might help us track how we're doing across each of those domains. So these are pieces that we're currently working on to build into our evaluation framework so we can really understand if we're making the intended impact across the system. So again, two key clinical programs that we're running that I'm going to talk about in a very high level. I will not get into the nuances of the service delivery, but our mental health and substance use program, which was historically what we referred to as SAPACY, and we also have a Justice Center partnership with the Ministry of the Attorney General that I'll share about as well. But our mental health and substance use program, essentially, there are 8 core services that we're providing. So it's assessment and treatment planning that's really led by registered social workers at many of our sites and child and youth workers who work in like a case management type of service. Counseling and psychotherapy. We have psychiatry. So we have 3 psychiatrists at our site at CAMH, and they provide consultation to all of our community partner sites. We're looking to develop more and more groups. We do some groups currently, but looking to develop more group-based models of care as well. Caregiver support. We know that caregivers need to be supported adequately to be able to support young people. So we're definitely doing that as well. And case management, service navigation, and health promotion pieces. So we do a lot of outreach in schools and community centers and do presentations for young people in the community. Our Justice Center partnership is another program that we're doing. This is a partnership with the Ministry of the Attorney General. And with this partnership in particular, we're able to embed a social worker and a clinical psychologist directly into this court model. So the idea of this model is it takes court out of traditional courtrooms and moves it into community settings. So the idea is when there are young people under the Youth Criminal Justice Act, so this is young people under 18, who are identified as having or who could potentially have a mental health challenge, we can actually do an assessment right there, which can be used as a mitigating factor in their proceedings. We're already seeing through that partnership an immediate impact on disrupting that pathway into the criminal justice system and making sure that we're assessing so that if we think of like that young person that I shared their experience with, that some of those things might be more adequately addressed before they're actually even entering into a system so that we can assure that care is being provided. Won't get into all the details of the pathway, but this is again from the Justice Center team with the Ministry of the Attorney General, just to help folks understand kind of the pathway that a youth might get into this service from. And it's a voluntary service which they would opt into, and they're able to access a multitude of services. So you can see some of the service providers in that box in the middle there that collaborating with. So there's like an education advocate that supports with helping young people get connected back to school if they've been expelled, and many different services, really working from a restorative justice approach rather than just a criminal justice perspective. So, but don't take my word for it. I wanted to let you hear directly from a young person again. So we see some continuity from the story that we've published here. So this is published publicly on our CAMH website, Khadijah's story. So I'd like to share that with you now.
CAMH came into my life at a time when my son would have died. It was almost unheard of to have a 10-year-old with an addiction. All I could think of was, I got to get him somewhere. I don't have the resources. I don't have the tools to support him. You know, I remember calling one rehabilitation center, and they basically said, you're wasting your time, he's too young. But CAMH was there from the beginning. We started to work with SAPACY organization within CAMH that helps African and Caribbean youth. The workers there, they all looked like us.
Having someone or even hearing someone who has a similar story, I valued that. And by me valuing that, eventually I was going to listen to these people.
And it's not just about skin color. It's about understanding people that are disenfranchised in this community. And he was able to get help, and I was able to get help.
There's a process, you know, you get clean, you relapse, you get clean. It's not something that happens overnight. People need to sit down and take their time and be able to help people and focus on it before it gets to the point where you lose someone. My mom decided to learn, and that was the biggest thing, because once she understood me, then we could have conversations.
I've had to dig and beg and pull and cry and curse, but I would never change that.
Just taking that first step makes a big difference. I've always wanted to be a social worker or a lawyer. Regardless, I'm going to use the mental health experience to help people And I think it's going to be exciting.
His story is a triumph, and that should be celebrated.
Just wanted to share that piece there to really highlight the power of representation and care and what that can do for young people and how it can shift their trajectory. So last but not least, I want to leave you with 3 key take-home messages before we get into any questions that you might have. And these are lessons that we've learned over time. So I thank my team and some of my mentors that have helped us really think about some of these lessons over time. So I'm sharing on behalf of the team, not just my own thoughts here. So one of the key pieces that we see a lot, the inverse care law. And we also know that the most in need of services are the least likely to receive it. And I think it's a really helpful piece for us to really frame when we're thinking about service delivery and access. Who are we actually creating access for, and who's being left on the margins? Usually it's folks who are in tremendous need of help that are not accessing it based on how we've built systems. So how do we unpack that and create better pathways to care? Number 2, change happens at the speed of trust. I think it's really important when we're thinking about community partners, understanding that until we've built trust, folks aren't going to be able to work with us in a meaningful way. So we really have to build that trust in a meaningful way with communities to move pieces forward. And last but not least, addressing health equity is an investment, not an expense, where you need to invest in health equity so that we can address these disparities over time. So I'm going to leave you with a quote before we enter questions, a quote I really like, and I think it really captures what we're doing here. Remember to imagine and craft the worlds you cannot live without, just as you dismantled the ones you cannot live within. So with that, thank you, and I'll happy to take any questions.
Okay. Thank you so much, Kevin. We now have time for some questions. Attendees can enter their questions through the chat feature on the right-hand side of their screen. And a reminder that the chat feature is only available for those accessing the session on a computer or a laptop and not from a phone or tablet. Just scrolling through the chat and the engagement on the chat, there's definitely a consensus for the need for these models and programs like AMANI, and also just, different lenses and approaches needed for, justice-informed care, and how important culturally sensitive approaches are to care like this for Black youth. Just gonna scroll through the chat. Yeah, it's just a lot of consensus and a lot of praise for addressing such a needed topic. Right now, we don't have any questions from the chat. I can open up the floor. Oh, okay, yeah. So I have one here. As a Black social worker, how do I develop radical ways to address anti-Black racial burnout? Many of us have limited to no support while doing the work.
It's a very good question, and I think it's also something that we're very actively working on and continue to work on as we're building our service too. And I think I'm going to give you an answer that's a non-answer. It's hard. It's a work in progress. I don't know that any one of us has figured that out, particularly because there's just so much to do. Sometimes we see so much need. So I can give you the pieces that we like to instill when we think of like self-care is really important. Figuring out what self-care means to you, whether it's walking, exercising, music, some of those pieces. That's an important piece. I know we talk about it a lot, and sometimes it can feel like a little bit of a cliche, but it's really important, and I think it really helps us to move pieces forward. The second piece I would say is understanding that you're not doing the work alone, and to find your community, because I think that's a really important piece. It can feel so isolating and like a daunting task if you're trying to address these pieces on your own, but how do you actually find a community of practice who can support you? And that can be whether it's in your institution, it can be through community partnerships, it can be through broader clinical supervision, what have you. So again, when we looked at some of the work that we were doing with our model, we tried to connect community partners and communities of practice so that folks across the province, who maybe are few and far between in terms of who are working in this model in different areas across the province, can connect them with the broader cohort of folks who are doing this work here in Toronto, in the Greater Toronto area, and across the province as well. So it's really about finding community. and pacing yourself, right? I think oftentimes in these helping professions, we're wanting to help people so much, but we don't often think about ourselves. And sometimes we use that analogy of, when you're on a plane and the oxygen masks drop and they say you got to put yours on first before you can help other people. So reminding yourself it's okay to put your oxygen mask on as well when you need some of that time.
Thank you. Yeah, that's all the questions we have in the chat so far. I'd like to open up the floor to anybody here. Yep.
Thank you so much for your presentation. It was so great. I want to, I guess, I'm curious around, because the theme of today, in so many ways, has also been talking about the ways in which resistance kind of shows up. And I guess working through the resistance, whether it be, and I guess connected to that question around burnout, we were talking, it was like loss and grief and other pieces, right? So like the underbelly to the work. And I know that you've done such a great job in kind of showing how the work moves, but it's been moving since the 90s, which is like, also shows how iterative this work is. But I guess for, as yourself leading this work, have you found that there have been these points of like resistance and barriers, especially when you're working across systems, multiple partnerships, the lack of goodwill around investing in this work? Because I think it was one of your quotes that talked about, it was such a good one. It was the first quote that had around how
racism, was it?
Yeah.
Like not necessarily merely like a simplistic hatred. Was it that piece? Or?
Yes,
Yeah.
that one.
Yeah.
And so the lack of compassion, the lack of value that's placed on the group that you are leading a program for, have you found inherent to that also comes resistance, whether within the organization, above you, within working with other systems and other leaders? Like, how have you navigated that? And have you found that there's even been resistance, or have people been like, they've been all on board from day one in terms of building that web of partnership?
Well, thank you for that. It's a really great question. This is a question that keeps me up at night sometimes, both literally, figuratively. But I think when I think about the work that we're doing, there's kind of like a two-pronged piece to that. So I think there's a lot of people who are supportive, and I think support means different things to different people. So that can mean, folks who have an idea of what they think it might need to look like. And so it's about building consensus among ourselves and our allies. I think that's one piece. But when I look at the broader system, there are most certainly points of resistance. So sometimes the question we might get is, well, why do we need a program like this? Like, why can't they just go to any other program for youth, right? So like, I think some of that resistance is built into the understanding. So like, for example, when we look at this presentation that I gave, this is where I think it's really important to unpack the systemic context, because if you don't do that, when you get those questions of like, why do you need this program, it's kind of unclear. But so when I face those pieces of resistance, I again try to reframe it as, again, it's one of my social worker skills. How do I reframe that? Actually, like, this is a need for education on the subject matter versus necessarily a piece of resistance, and how can I actually educate to why we need things like this, right? Or like why power structures might not allow for it to be integrated into more mainstream systems, because it might lose some of the essence of what we're actually trying to address. But that doesn't mean that we can't collaborate and work collaboratively across the system, right? So again, it's really looking at what's the underlying intention of a question, right? So if there's a resistance to like why this program is needed, well, where is that coming from? Are we looking at wanting to build broader system integration, and like what are the pathways through there to get there? But that doesn't mean that happens without a program like this existing, right? And I think the third and final piece is it's a lot of work, like to get the funding to mobilize. Like there's a lot of work to move these pieces forward. I'm fortunate to have a great team around me and through the network, but it's the power in numbers, right? So sometimes we pull on like different like African proverbs, right? Like sticks in a bundle won't break, right? So when we think of things like how when we're collectively together, there's strength being collective, right? So how I'm not speaking from an individual voice, I'm speaking from a systems voice, right? And I think that's important. That's why it's so important to partner meaningfully with community, because we're going to need each other at all points across the journey. But the closer and more connected we can keep ourselves really aligned with that shared vision, it's a powerful force. And, I'm confident in our ability to move through those pieces of resistance. It feels uncomfortable sometimes, but just accept that as part of the process towards, keep our eyes on the bigger vision and keep moving the work forward. Hope that answers.
Just a quick question, Kevin. Thank you so much for the presentation and the discussions, and really incredible work that you guys are doing, and really commend you and the organization for it. My question is, I guess it's a bit more of an extension of the previous question. In thinking about, I think sometimes like partnerships and collaboration and community, knowing how stark those stats were with regards to that 38% will access, but 60%, thinking about I would access even more if the individuals look like me. How in moving ahead with some of the partnerships and the collaborations that you're doing, how do you guys balance new collaborations or new connections in a way that ensures that it's not undoing all the important work that you've established up until this point? And it comes to mind for me because I remember having a supervisor years ago and working for a community agency. And at the time, safe space training was such a big thing. And then you get the sticker, you get to put out your window as a clinician. But then you'd sometimes interact with your colleagues, and you're like, I don't know if this colleague is, actually really appreciates this training. And based on how my interaction with this colleague, I'm really unsure how they may be with clients, but they have that sticker on their window and so forth. And so in just kind of thinking about, again, the as expansion happens and as, growth happens and people want to be allies, people want to partner, how you find that balance in ensuring that people are well trained and true allies, I guess, like without undoing what you're really trying to do. Thanks.
No, thank you. It's a really great question. Very difficult piece. So I often try to root ourselves back to our governance model, right? So that constellation model that I kind of shared. And it's really about understanding that, we have our community partners who are inherently part of this initiative, who are funded to be part of this initiative, but we're not everybody as it relates to diverse Black communities. There's so many different partners at play. There's so many different allies who could be supportive of the work too. So it's about how do we actually bring folks into the work, but stay true to the key premises of this collective impact and what that governance looks like. So what I really appreciate about that model is it leaves room for broader partners to be supportive and engaged in the initiative as well. So theoretically, any of those different constellations that I shared there could have representation of different partners who are helping us co-create solutions, but it doesn't necessarily mean that they're part of that inherent governance structure that I share, that leadership table, which all of our sites sit at. So that's kind of our key structure, almost like a community-based steering committee. And a good example of that is our French language services working group that we're just convening now. We have diverse partners. There's a provincial French language network across Ontario that we've been collaborating with to really vision what this work could look like in terms of delivering care in French to Black youth. So we have many folks in that in that space who actually aren't part of our direct initiative, but they're still sitting on that table to focus in on that subject matter. So thinking about, our youth advisory is another great example. We're bringing in youth from across the province from many different experiences. So how do we get a diversity of perspectives, which we need because the issue is so complex, but also how do we stay tight in terms of what our governance is, and how do we build capacity over time. So again, that's another example. We have our communities of practice with our supervisors, our clinical supervisors, our social workers, so that when we're onboarding and bringing in new partners, they're connecting in with an ecosystem who's supporting and building capacity. And again, training and all those pieces are important too. But it's again, finding your people and building community around the different systems so that no one individual feels that they're doing it on their own. So in that example, you don't have to go look for the sticker because you have a meeting on Tuesday with everybody who you already know has that is working from that perspective as well. I do.
All right. Thank you so much, Kevin, for such an informative and insightful presentation. I really appreciated learning more about AMANI, and I know all of our attendees did as well. So that kind of concludes our educational session today.